Good morning, good evening, good afternoon, depending on where in the world you are. Welcome to this month's webinar. I'm Dr. Shabnam Das Kar. I'm a functional medicine doctor. I live in Alberta in Canada, and I was formerly an OBGY, but many years ago, I gave up practicing OBGY and moved into functional medicine full time. So welcome to this webinar and a happy new year. And thank you very much for investing your time with me here today. Today's topic is therapeutic lifestyle change for heart and brain fitness. Now, we know that heart and brain health are not really distinct from each other. In fact, the body does not have separate, heart health versus brain health versus health in general. So what you will find out today is I am going to talk interchangeably about what is heart health and brain health. So basically what is most important to know or remember is heart health and brain health are about the same in terms of how you manage your risks. So that is something I wanted to mention, because in case I don't keep saying heart health, brain health every time, remember that it applies equally to both. So I will start with a PowerPoint presentation. And at the end of it, I'm going to have time set aside for questions. And I think I can unmute you for you to ask questions, or you can ask in the chat box or in the Q&A. So I'll let you decide how you want to ask your questions, but definitely I'm going to have time for questions at the end. So let me just start sharing my screen. Okay. So first and foremost, a very happy new year. And I am wishing that all of you are happy, healthy, and safe. Given the ongoing pandemic and the way things are going now, it is likely that all of us are going to get the coronavirus infection at some point in time. But the most important thing is 2 years ago, when the pandemic first started, I had started a free course about in improving your personal immune resilience. And the only thing I noticed that has changed is now we have a vaccine, but back then we didn't have a vaccine, but it was equally important about your personal health, particularly your metabolic health in relation to your risk for diabetes, what your blood glucose levels were, what your inflammation levels were. Those factors are equally important even today. So when I say therapeutic lifestyle change, what do I actually mean? So therapeutic lifestyle change means that these are strategies that I'm going to talk about, which have actually been tested in clinical studies. So what are clinical studies? Clinical studies are basically a group of people who have been put through the steps of any of these lifestyle changes, and it has shown a beneficial outcome. So therapeutic meaning, just as taking a prescription medication would be for therapy, likewise it is with therapeutic lifestyle change. So this is a TLC of a different kind. And if you have heard me speak before, you know that, sorry, my screen has become all confusing. You have seen me use this particular graphic numerous times. So basically how, whether you want to call it allopathic medicine, Western medicine, it is the medicine that I have been trained in. We look at your health in terms of, gastroenterology, cardiology. I was an OBGY, so obstetrics, gynecology, endocrinology, nephrology, psychiatry. There are a whole lot of other specialties as well. The point is, these constructs are artificial. So like I said at the beginning, heart health is not distinct from brain health, but our bodies are not really divided into different systems. Everything is connected to everything else. As I keep saying, the body didn't get the memo that, the heart is not supposed to communicate with the brain, or the gut is not supposed to communicate with the brain or any of the other organs. So basically, the major difference in how we look at health in general is in terms of how we look at the body. So in functional medicine, we look at the whole body as a network of networks. And as you've probably, all of you have seen me talk about this, this is I call this my constellation. So this is basically some of the basic processes in your body, basic important features in your body that are relevant for every kind of health, whether it is heart health or brain health or digestive health or overall health in general. Now, obviously, all of these areas will not come under lifestyle, therapeutic lifestyle change. But interestingly, you can impact almost all these areas with therapeutic lifestyle strategies that I'm going to briefly discuss today. So some of the top, most important ones: chronic inflammation, circadian rhythm, environmental toxins. You can see all of them. Food is one of the biggest, deciding factors. It's one of the major factors that impacts your health. So when it comes to the brain and heart health, now you can see in this infographic, it says foundations of brain health. And like I said before, brain health is not distinct from heart health, and it's not distinct from health in general. So foundations, meaning these form the very, the base over which everything else is going to work. So the three most important factors are optimal blood glucose levels, optimal blood pressure levels, and low levels of chronic inflammation. And how will you figure out what these numbers should be? I'm going to talk about that today. That is probably going to be one of your major takeaways from today's webinar. I always try to provide some information about, sort of what is the science, what is it telling us? But I want to focus more on things that you can do for yourself. There is a lot that you can do for yourself, but at the same time, I also want to stress that whatever I'm talking about today is for information purposes only. This is not medical advice. Even if you're my patient, this is not your medical advice unless I have talked about these things in a one-on-one consultation. Now, I'm going to leave this particular slide on for a little while. And this, I must thank my associate, Mikhail Offer. So both of us have created this together. And just because this is a pyramid doesn't mean that the things at the bottom are the most important. Now, you will notice that a large part of it, so, almost more than 2/3 of it involves food. So that is how important food is. Sleep, daily sunlight exposure, movement and exercise, mind-body interventions, social connections, time-restricted eating, intermittent fasting, about which I talked about in December, the December webinar. When you look at food, what is the most important thing you need to focus on, particularly when it comes to your brain and heart health? Number one is prioritize protein. So protein would depend on what protein you eat. If you're vegetarian, you will eat proteins like maybe tofu or cottage cheese or things like that. If you're vegan, then your options are further limited. If you eat meat, fish, eggs, all these things, seafood, those are excellent sources of protein. Then healthy fat. So healthy fat, as you've probably heard me speak before, is fat as nature made it fat. So coconut, for example, is naturally fatty. Avocado is naturally fatty. Olives are naturally fatty. Nuts have natural fat in them. Then comes dairy. Now, dairy is again a little different for each person. There are a lot of people who cannot tolerate dairy, and it is not necessarily a lactose intolerance always. When it comes to dairy, if you have gone through an elimination diet, you know what we mean by that. So dairy, some people may be sensitive to cow milk, but they may be absolutely fine with goat milk or sheep milk. Or sheep milk cheese is okay, but cow milk cheese is not okay. So you need to figure out whether you have sensitivities to dairy. Not everyone is sensitive to dairy. And particularly a lot of my patients are vegetarians. You need to figure out very accurately whether you have, dairy sensitivity rather than stopping all dairy product at a time. You need to figure out whether you really have sensitivity to many of them, because otherwise you have fairly limited options of food to eat. Non-starchy vegetables, whether it is broccoli, cabbage, cauliflower, all these things. Starchy vegetables, depending on how good your, how much of metabolic reserve you have. If you have, if you are insulin resistant, that means you have either belly fat, fatty liver, your liver enzymes are going up, you have PCOS, you had pregnancy diabetes earlier on, or you have a family history of type 2 diabetes, then it is likely that, or you have more belly fat, I said that already, higher waist to hip ratio, then it is likely that you have a problem with your carbohydrate insulin metabolism. So in someone like you, because the three fundamentals, number one is optimal blood glucose levels. So someone like you, starchy vegetables, you may need to reduce. But when it comes to food, everything depends on what your baseline food is like. So someone who eats a lot of processed food, things like burgers and pizzas and sandwiches and rice and pasta. So for that person to move into, more nutritious food where you prioritize protein and good quality fat and less of carbohydrates, that itself can be a dramatic improvement. But if you are someone who's already eating, highly nutritious food, you don't eat processed food, you don't eat packaged stuff, you don't eat a lot of sugary stuff, then you may need to look at, is there something more that you're missing out on food, or is there anything else you want to change? Or is it some other area? Maybe it is your sleep you need to focus on, or it is your daily movement. Are you moving enough? Are you getting adequate exercise? So going back to food now, beans and lentils, yes, again, they are real food, but for some people, beans and lentils can raise blood glucose levels very high. So you need to watch out for that. So beans and lentils may not be the best food for you. And again, it depends. Like I said, each person is different. However, if you're, vegetarian, then beans and lentils may be one of the sources of food for you. Next comes fruit. Now, fruit is nature's candy. So you're not going to have a ton of candy. Likewise, fruit is ideally used as a dessert, and not less sugary fruit, things like berries. Again, everything is in context. Everything depends on what is going on with you and your insulin and carbohydrate metabolism. Herbs and spices, there is no limit to how much you can take that. Obviously, if you like flavorful food, I am originally from India, so I like flavors. I cannot have bland food. So there is no restriction on that. You can cook with all the spices that your family is used to, that your ancestors were used to. Next is water to quench your thirst. So there is no data which supports 8 glasses of water or 10 glasses of water. So when you're thirsty, you need to drink water. The other important factor that I want to stress upon is whole grains. So everywhere you read, you will find people talking about whole grains are healthy. You need to have whole grains. And Mikhal and I actually did a podcast on whole grains. So number one, for many people, grains are extremely inflammatory. And for many people, grains can raise blood glucose levels very high, and you won't know until you're actually measuring. So how will you know whether grains are a problem for you? Number one is, the easier way is stop eating grains for 1 to 2 weeks and see how you feel. So you can track your before and after symptoms. And if you have a glucometer at home, or you're using a continuous blood glucose monitor, then it's much easier for you. So you can eat first you check your blood glucose levels in the fasted state. After that, you eat something and then check it after 1 hour and 2 hours. So if you don't check at the 1 hour interval, sometimes you may miss a peak of blood glucose rise, which does not show up at the 2 hour level. If you're wearing a continuous blood glucose monitor, of course, you can check all the individual levels. So going back to, whole grains are not healthy for all. So remember that, keep that in mind. Vegetable oils, so all these seed oils, the processed industrial seed oils, those are unhealthy for everyone. And then the third component comes targeted supplementation. So everything is important for the brain. And this is, feel free to take a picture of this slide. And of course, I'm going to post this video on the YouTube channel. And if you want to take a picture and take a printout and give it on your fridge so that you can remind yourself what is good for the heart and brain, please feel free to do this, share it, because this is now one area I wanted to focus upon, which is not really medical in that sense, is your social connections. Given the ongoing pandemic and given how a lot of older people are, isolated. Now, being isolated and being lonely are two different things. So sometimes you may live in, with a lot of other people as well, your whole family, but you are still lonely because you don't have the kind of connections that you'd like to have. And loneliness and isolation actually have both been found to be a very high risk factor for cognitive decline as well as poor overall health. So what are you, given, what is going on in the world today, do you have people you can call just because you want to talk to somebody? Do you have someone who can, take you to, you're not feeling well and you need some grocery? Yes, I know there are, apps which can deliver your groceries, but do you have a friend who can maybe say, okay, I'm going to cook some food for you. I'm cooking for my family. I'm going to leave some at your doorstep. And if you don't have, what are the ways you can do? You can create connections. So find out what works for you. Starting off with online connections is not a bad idea at all. And I'm sure everyone has, some friends or relatives, or in fact, in some areas, what people have started doing is, because there are a lot of older people who live by themselves, they have kind of created a network of, friends of friends, so to say, so that they just check on each other. Sometimes probably all you need someone to do is call you and ask you, how are you doing today? So simple things like that. And again, I know it's not always simple. Maybe you are not the type of person who would want to make a phone call, who like to connect online. My point is, find out ways in which you can stay connected. This is an area which is, again, very important for everyone. So what are the most important numbers to know? And I'm going to leave this slide on for some time because this is very important. Number one is optimal blood glucose levels. Now you can see in both the Canadian and the US and Indian units as well. So 3.9 to 7.2 is what most of us say is ideal. Some people say, okay, maybe you can go up to 7.7, but not more than that. So this is the range you want your blood glucose numbers to be throughout the day and night. So in not just in diabetes, in the entire blood glucose world, I would say, we are going more towards what is called time in range. So if this is your range, and again, it's different things for different people. If you have diabetes and your blood glucose levels are very high, for a short span of time, you may need to look at keeping it less than 180. But your final goal, and again, this is not medical advice, you need to talk to your doctor. Your final goal will definitely be to keep it less than 140 or 130. Because over long term, blood glucose levels in this very strict, shorter or smaller range between 70 and 130 have shown much better outcome in terms of brain and heart health. In fact, Alzheimer's disease is considered to be type 3 diabetes. So obviously, that diabetes means blood glucose levels are higher. And when it comes to Alzheimer's being called type 3 diabetes, what it means is the brain sometimes in Alzheimer's and some other dementias as well, loses its ability to use glucose as a fuel. So it is in diabetes of the brain, it may not be of the rest of the body also. So that is why having blood glucose levels in a stricter, and less ups and downs, that is extremely important. Now, I was surprised recently when someone told me, oh yeah, my doctor says, what if my blood glucose levels go up to 200 after I eat food? That is normal. I just need to walk and it will come down. Well, yes and no. Yes, it will come down, but you never want your blood glucose levels to. So this is like 200 in terms of milligram per deciliter. So it is not okay for your blood glucose levels to go up to those high levels at any point in time. So the more you can bring it down and the more you can make it more even keeled rather than like going up and down zigzag, that is much better and much better numbers to focus on. Next comes blood pressure. A few years ago, the blood pressure numbers that have changed. So 120 by 80 millimeters of mercury is considered normal. And again, this is not medical advice. For some of you, this may involve taking more than one medication along with lifestyle changes. When it comes to blood pressure, now this is a few days ago, I posted on LinkedIn. I said, some people, I've been told that in 2017, when the sprint trial came out, blood pressure numbers were considered to be 120/80 was considered to be normal. Anything higher than that was considered to be high. Some people have been saying that that's a pharma company strategy, but I definitely, that is not the point. The point is, lifestyle changes can have a huge impact on your blood pressure. So my point is not that you need to get it to 120/80 by taking 10 medications, but what if you could bring it down to 120/80 with, if you have hypertension, and hypertension is one of the commonest conditions worldwide, and it is very poorly managed. So what if you could focus on other things? So what are some of the other things I would recommend in terms of lifestyle? Deep sleep. Deep sleep is one of the best antihypertensives ever. So deep sleep is one. Weight loss is another one. And weight loss doesn't mean you need to lose, hundreds of pounds, even as little as, 5 to 10%. So when we say 5 to 10%, what does it mean? So let us say if you're, today your weight is 150 pounds and you lose 10% of it, that's just 15 pounds. That can have a huge impact on your blood pressure numbers. The next is, there are some supplements. If you have high uric acid levels, lowering your uric acid levels by, first of all, looking at how much of fructose you are taking, whether your fructose comes from, soda or like soft drinks, that is the worst possible source of fructose. Or are you having a ton of fruit smoothies? That is another source of fructose. That can lower your uric acid levels. Taking vitamin C at 1500 to 2000 milligram a day can lower your vitamin C levels. Can lower your uric acid levels, and lower uric acid levels can lower your blood pressure. Particularly concerning nowadays is the high incidence of diabetes and hypertension in young people. So obviously we have to look at more, natural ways or more ways of adding more supplements versus adding another 10 prescription medications. And I am not against prescription medications. When it is necessary, it has to be taken. But my point is, there are numerous other ways to add. Another big one is magnesium. Magnesium can help reduce blood pressure as well as blood glucose numbers. Omega-3 fatty acids are also very important. So all omega-3 fatty acids will help in managing inflammation, managing blood glucose levels, lowering your triglyceride levels, and managing blood pressure as well. The third number to know, as you can see here, is something called HSCRP. So that is highly sensitive C-reactive protein. That is a blood test which can be done anywhere in the world. And most of the time, most doctors don't do it. And the reason is probably, unlike functional medicine doctors, they may not know how to lower it. It's not necessarily that you just have to take an anti-inflammatory medication and it's going to come down. So HSCRP can be high if you have an acute infection, acute inflammation. But if it persists for a long term, then we know that that is most likely high level of chronic inflammation. Chronic inflammation is related to 95% of all diseases, particularly heart disease and brain disease. So you want that HSCRP number to be lower. And one of the commonest sources of higher inflammation is food. So food is the major area. So once you've taken care of your food, then you need to look at other sources of where the inflammation could be coming from. Number 4 is again something that I actually test for. I check for your sitting disease risk, and there are some online calculators you can Google for them. Ideally, your daily sitting, continuous sitting. So continuous sitting is supposed to be as bad as or even worse than smoking. And continuous sitting impairs your brain activity, raises your blood glucose levels, impairs your muscles. And your muscles are an extremely important organ when it comes to your blood glucose levels. So obviously, remember the three fundamentals. So blood glucose, blood pressure, and inflammation, all those are impacted by muscle function. And sitting continuously impairs your muscle function quite a lot. So there was a paper a few years ago, type 2 diabetes sits on a chair. So how long are you spending sitting continuously? And what can you do to stop that or reduce that? Next comes sleep, 7 to 9 hours of restful sleep. Do you feel rested when you wake up in the morning? That is the most important question to ask yourself. Or if you're using a wearable device, you will also know that you can check your sleep data on that. And if you're not sleeping not getting restful sleep, there are ways to manage that as well. Another important factor I wanted to mention is if you are sleeping longer than 9 hours, that could be a red flag for mood disorders or cognition as well. So that is something you need to also be aware of. Number 6 is exercise or movement. So 150 to 300 minutes of moderate intensity activity per week. What do I mean by moderate intensity activity? So moderate intensity activity is anything that you do which makes you, you can speak, but you can't sing. So you can have a conversation when you're doing moderate intensity activity, but you cannot sing. And higher intensity activity is when you can't even talk. So things like, shoveling, gardening, these are also moderate intensity activity. And in 2020, actually, Canada came up with a very nice guideline. This is called the 24-hour movement guidelines. And I absolutely love it because, what you do throughout the 24 hours actually makes all the difference. Even if you have done high intensity exercise in the morning for half an hour, 1 hour, whatever it is, and then you spend the rest of your day sitting at your job or you're watching a lot of television, that completely takes away all the benefits from that exercise in the morning. And when it comes to your brain fitness, particularly, moderate and higher intensity activity actually is extremely important because there is something called BDNF, brain derived neurotropic factor. So higher BDNF levels help in keeping your brain sharp and preventing dementia. And moderate intensity exercise raises your BDNF levels even more. Now, interestingly, this 24-hour movement guidelines, the Canadian 24-hour movement guidelines also has added, standing time. So are you spending a lot of time standing? That can be included in your movement time as well. And a few years ago, I made a decision that every Zoom call or webinar or, any of this, I'm going to do in standing up. So I've moved the chair away from my workplace, workroom. So I work mostly from home. And so now if I have to sit, I actually have to go and find the chair and bring it along to the table. So that's just basically how I decided to design my environment. So what are the things you can do? Number one is figure out what it is for you. Are you spending a lot of time sitting? If you are, what are some of the strategies you can implement? Maybe if you are someone who has a lot of phone calls at work, can you walk when you are, walk at home when you are on your phone calls? That is one of the strategies that my patients and a lot of other people find very beneficial. And at the end of today's session, I'm going to talk about an upcoming course that I'm very excited about. This is a brain health course. So going back to the 24-hour movement guidelines, so reduce sedentary time, again, extremely important. And here it says, designate a screen-free zone in the house, like bedrooms and at the dinner table. So no, having food in front of the TV. That is something important because obviously you're not going to stand eating food in front of the TV. So that is one of the things. maybe you can reduce that and figure out ways what applies to you. It's not the same thing for everyone. Sleeping well, alcohol and sleep is again something extremely important, because if you drink later on in the evening, what ends up happening is you don't sleep as well. So sleep quality, so what we call the sleep architecture, gets impacted because of alcohol. And another thing that happens is you end up processing your food differently because the body cannot store alcohol. And my associate Mikhal talks very nicely about something called oxidative priority. So your bodies have to process the alcohol first before they can reach the food. And if you end up eating a lot of high carbohydrate food along with alcohol, what ends up happening is your blood glucose levels next morning may be very high. So if you have found that that is one of your problems, you need to actually figure out what is causing it, and always find the solution may be something that has happened before. So that is something extremely important about alcohol and sleep and brain and heart health. So this is again going back to the lifestyle pyramid and how you can impact all of these. So basically all these, the top three, so those are, I put them in blue for that reason. These can be impacted by all of these, everything. But the most important question is, where should you start? Now that is something that, I trained myself as a Tiny Habits coach recently. And so Tiny Habits is a method that was developed by Dr. B.J. Fogg, who is the head of the behavior design lab at Stanford University. And he says, people people change best by feeling good, not by feeling bad, number one. Number two is help people do what they already want to do. So in the Tiny Habits world, there are no shoulds. So I was so used to, the usual method of, give them information and people are going to take action. So BJ calls the information action fallacy. So information alone is not going to make you healthier than you are today. What you need to do is take action. And where do you start? Start with what you want to change, not what, oh, Dr. Shabnam said I should sleep, and you don't want to focus on sleep today. You would much rather focus on movement. Then start with movement. And this is new to me. I used to think, oh, what if someone decides to do things that are not really going to make a huge impact on their lives? But what BJ found in his research is, once people start doing, things that they already want to do, and they feel successful, what ends up happening is they do the more difficult things. So that is a message which is much more exciting, because I find that works a whole lot better than the usual method that I used of giving a lot of information. And I used to feel, good that, okay, instead of a prescription pill, now I'm talking about lifestyle changes. But it is still change. And it is still difficult for a lot of people. And it is still difficult to maintain. How do I know that? I have the same challenges as well. So recently, my wearable, I use a Fitbit Sense. Every week it sends a report. So it sent a report that my sitting time was very high. And I didn't realize that, because I thought I spent so much time, on phone calls and Zoom calls and all that, and I'm always standing for those. What I didn't realize is, in addition to that, I also spend a lot of time sitting, because I'm preparing for presentations or I'm preparing for patient consults and things like that. So what did I do? I decided, no, I have to take some action. So I have a portable laptop stand. So now I just created a habit that after I have my first meal of the day, so it's usually a brunch, I am going to use my laptop on my laptop stand and not sit. So yes, I still have to review my data to see how much it has changed my sitting time, but definitely that is not something I would have done if my Fitbit hadn't warned me that I'm spending a lot more time sitting. So what is my point? My point is, based on what is going on in your health today, what is it you would, number one, where are you today? Number two is, where would you like to be in 6 months' time, in 3 months' time, in a year's time? You decide the timeline. And the third thing is, going away from this webinar, I mean, you are investing your valuable time here with me. what is the one action step you want to take? So I'm going to pause here for a little while, and I will let you, if you want to write it down, whatever works for you. You want to type it on your phone, if you used to journaling. What is the one thing you want to change? And feel free to ask me. Either you can type in the chat box, or I can unmute you to ask if you have a question. What is the one thing you're going to do going away from here? Are you going to change your sitting time? Are you going to focus on your sleep? Are you going to focus on your exercise? Where are you going to start today? So I'm going to pause here for a minute. And if you want to take a picture of the slide, please feel free to do that. And I think this is the last slide in my slide deck. Yes, that is the last one. So I'm going back to that slide. And I want you to go away from this webinar with some kind of an action step. Even if you don't share it with me, it's fine. But it's more, what is more important is you do, even if it's a teeny tiny thing, even if it's something as simple as I'm going to keep a bottle of water next to me at my table, or I'm going to get up for my phone calls. Okay, so I'm going to stop sharing the screen, and you will receive a recording of this. And if you have any questions, please feel free to ask. I can unmute you. I think you can raise your hand. If you raise your hand, I can unmute you. And if you think of something later on, feel free to email me. My clinic email is info @drkarmd.com, drkarmd.com. So your questions are always welcome. And so far, I don't see any questions. Okay. Thank you, everybody, and see you next month. And stay safe. Bye now.